And I told you yesterday, new guidance has come from the CDC, and we're working with that now. So MIS-C. The symptoms are there on the screen. We've talked about them a number of times. If any child in your life has those symptoms, particularly in combination, please call your doctor immediately. If you don't have a doctor, call 311. Now, as of this moment, with the initial definition we used, 147 confirmed cases, 69 of those cases, kids who tested positive for COVID or had antibodies. One child has been lost, and obviously we never want to lose another child. We're going to have more updated information with the new categories, the new specifications we've gotten from the CDC. We will keep updating you on what we're learning as a result of the work the CDC is doing. But the bottom line is, it is so important to just get the message out. Early detection makes a huge difference. If you see these symptoms in children, call it in to a healthcare professional immediately so we can protect that child. Now, to protect all of us, we need to make sure our hospitals, our healthcare providers, have the blood supply that they need. Normally, honestly, this is something that year in, year out, the blood supply is secure, it's strong. We've really not had a situation like this before. I've talked to a lot of our health leaders and they don't remember anything like this, but it stands to reason. We've never had an economic shutdown before. And a huge amount of the blood supply came from corporate blood drives by different organizations, charitable civic organizations, government agencies typically would do a blood drive. So all of that's been cut off and disrupted. Therefore, the blood supply has gotten lower than we ever could have imagined. Now, we're going to put additional safeguards in place going forward to make sure that we don't have this kind of situation again, and we're encouraging all New Yorkers who can give blood to do so right away. We started talking about this a couple of days ago. So far, 2,500 New Yorkers have made appointments to give blood just in the last few days. That's a great start. That's going to help a lot. But I want to see thousands more come forward. I'm going to do it myself. I want to see thousands come forward to give blood to make sure our hospitals have what they need. So all sorts of times I've heard New Yorkers say they want to help in this crisis, and I believe you, and so many good people doing so much to help their fellow New Yorker. If you can give blood, this is a good moment to give back to this city. This is absolutely a reason to travel, to go and give blood. You're doing a great public service for your fellow New Yorker. So anyone who can, we need you. Make an appointment with the New York Blood Center today. You go online, nybc.org. I'll say again, nybc.org. Or you can call 800-933-2566 and make an appointment and give blood and save lives. Okay. Now, when we think about what we've learned, and we've all learned so much during this crisis, here's a disease that, again, less than a year ago, no one had heard of in terms of it being something that affected human beings. And we've all had to make so many adjustments, learn so much, and we still don't know everything that we need to know about this disease. The entire international medical community doesn't know enough. But there's some things we do know, and one of the things we've seen here in the city and around our nation is that this disease amplifies the disparities that already exist in our society. And it's painful because we're talking about disparities based on race and class. We're talking about both ethnic and economic disparities that have plagued our city, our nation. And once again, we see that those who are suffering the most, lower income folks, folks in communities of color, folks in the immigrant communities. So that has been the healthcare reality, but we know on top of that, adding to the pain, has been the economic impact as well. This double crisis, the worst healthcare crisis in a century in this country and the worst economic crisis since the Great Depression. What a horrible 1-2 punch, and of course, communities that were already hurting are now taking the hit even harder. We, the city of New York, our city government, we're going to fight back. we're going to use all our tools to fight disparity. We've been doing that in so many ways over the last 6.5 years. We're going to amplify those efforts. And that means every conceivable form of redistribution. That means making sure that we get resources to folks who have been unfairly denied resources, unfairly denied opportunity. And one of the best ways to do that is ensuring that more and more business goes to minority and women-owned businesses. We do that through a very aggressive MWBE contracting effort in the city of New York that's been growing by billions and billions of dollars every year. But we have to go even farther. We have to come up with new approaches, new innovations. We have to reach more and more MWBEs, because that is an act of fairness and justice, because we know when we provide resources to an MWBE, that money goes right into the neighborhood and circulates in the neighborhood and provides economic empowerment. People get hired. People who learn at one business start their own business. It's important anytime, but it's particularly important in light of this crisis. So we've had extraordinary efforts by those working on our MWBE initiatives over these last years. I want to thank our Deputy Mayor, Phil Thompson. I want to thank the man who led so many of our efforts, Janelle Doris, as director of our MWBE office, who has now become our Commissioner for Small Business Services. Greg Bishop, who was that commissioner, now my senior advisor, to help us build a whole new initiative to help small businesses in this city. They all made major, major contributions. But with Janelle taking on his new role, I have the honor of naming a new senior advisor and director for our MWBE office. The important thing to think about here is that we've got to do something transformative. We've got to do something different. And to do that, I wanted someone who had already proven her ability to make change and to take us places we hadn't been before. Magali Austin, known as Maggie. Maggie has served for years as our Chief Diversity and Industry Relations Officer for our Department of Design and Construction, DDC. Department of Design and Construction does a huge amount of work around this city. And what we saw, as with so many agencies, was there were extraordinary opportunities going missed to help minority and women-owned businesses to get a chance to win those contracts and build up their businesses and serve their communities. Maggie took a situation where there was many missed opportunities and turned it into a situation where opportunities were being fulfilled for so many companies. She did extraordinary work at DDC. She oversaw a portfolio of projects valued at over $20 billion, a team of almost 1,400 employees that she worked with to make change. And she did it very, very effectively. Maggie is a New Yorker through and through, grew up in the city, St. John's graduate, someone who loves and knows this city. So she is going to take the work that's been done these last years, and that has included more than doubling the number of certified MWBEs that can get this work with the city, and the huge expansion in contracts that has existed, and she's going to supercharge it, take it forward, and take us to a new place. And that is going to help us address the economic disparities and help communities back on their feet. So welcome, Maggie. I know you're going to hit the ground running, and we're going to be depending on you to help us fight our way back from this crisis. Okay, so I am thankful for the very, very talented members of this team who do such good work for the people of New York City. And I like to express that thanks all the time. And I've been noting lately when there are particular days or weeks or months that celebrate our public workforce and all the people who do so much good for us. So here is a moment where there's an annual week devoted to some heroes who we should be appreciative of anytime, any year. But this year, in this crisis, they have done extraordinary things. This week for 2020 is FDNY's EMS week. And it is falling at a very fitting time because our EMTs, our paramedics, our EMS staff have been superstars. So much has been asked of them. and they have performed brilliantly. This was literally, weeks ago, we hit the point in the entire history of New York City, the most calls went to EMS in its history. And it held, extraordinary organization held no matter what was thrown at it. Thank God the numbers have come way down and things are substantially back to normal. But these heroes, they went through so much and they did so much good and they saved so many lives. I think of all the members of EMS who fought so valiantly through this, but I particularly think about the 4 members of EMS who lost their lives in this crisis. EMT Gregory Hodge, EMT John Redd, EMT Idris Bey, EMT Richard Seabury. These were members of our EMS, valiant New Yorkers, gave everything they had to save lives and protect people. We've lost them and we need to honor them and remember them. And we also need to think about a man who came here from Colorado to help us. He didn't have to, he chose to. Paul Carey, serving as a paramedic here at the height of the crisis, and we lost him to the coronavirus as well. And we will remember all of them, and there's a special place in our heart for Paul's family. They will always be regarded by us as New Yorkers, and we'll always be there for them. So, the members of EMS have done amazing, amazing work. I've had the honor of speaking with a number of these heroes and thanking them and listening to their stories and understanding the amazing work they do. Please, if you see anyone who's part of EMS, give them a special thank you this week and every week for all they do. And we all know we've lost not just these extraordinary members of EMS, we've lost other first responders in this crisis. We've lost public health care workers. We've lost people who work in city agencies and served us. People who weren't famous, but people who were there for their fellow New Yorkers. We've lost a lot of public servants to this horrible disease that came out of nowhere and has afflicted us so deeply. 270 New York City employees have been lost to the coronavirus, 270. And it's so important for us to say to their families that we will be there for you, not just words, but deeds. We will be there for you. We owe that to you. Your loved one gave their all to us. We will be there for you. A few days ago, we extended health insurance for an additional 45 days to families of city employees that we've lost. That was at the request of the Municipal Labor Committee. And we've been fighting to get more and more benefits for the families who have lost loved ones in the federal stimulus legislation. And there is some very good activity in Washington. I want to be clear, in the stimulus passed by the House, in a separate bill passed by the Senate, sponsored by Senators Schumer and Gillibrand. Very good steps are being taken to help first responders, to help people who have been heroes in this crisis and the families of those we've lost. But we need to go farther. We waited to see what was going to happen in Washington. What we've seen is a step in the right direction, but it's not enough. So we need to go farther. Many leaders have called for new and better approaches to helping those that we have lost and their families. And I want you to know, everyone who's been raising the concern, I've been listening. Members of the City Council, I know in particular, Councilmember Danique Miller, Councilmember Joe Borelli have been two of the particularly strong voices. So I've come to the conclusion that the right thing to do is to help the families who have lost their loved ones, to give them line of duty benefits. This horrible crisis came out of nowhere, grabbed this city, and these valiant city employees kept fighting no matter what. The city of New York believes, I believe, they deserve, their families deserve line of duty benefits for any death that was connected to COVID-19. So to get that done, I'm calling upon the state of New York to act. And I am officially asking the state of New York to authorize line of duty benefits for those public employees that we've lost. We'll work with all of our partners in Albany to get this done. We'll work with the City Council. We need to take this weight off the shoulders of the families of these valiant New Yorkers. They need to know their futures will be secure. And look, we can give all the praise, and we mean it. I know I speak on behalf of 8.6 million New Yorkers when I express my condolences to the families who have lost their loved one, my appreciation for all these public servants we've lost and all they've done for us. But these families need to know that they will be protected, and that's why we're going to fight for line of duty benefits for them to protect their futures. Okay, now let's talk about our daily indicators. This is what we every day look to help us understand how far we've come and where we're going. Some days are really good, other days are a mixed bag. Today is a mixed bag, and it's a reminder of how much we have to stick to the plan. So, indicator 1, daily number of people admitted to hospitals for suspected COVID-19 is up from 48 to 57. Again, a much lower number than we used to have, which I always appreciate, but still, numbers going in the wrong direction today. Daily number of people in ICUs across health and hospitals for suspected COVID-19 has also gone up from 475 to 492. But the percentage of people who tested positive for COVID-19 citywide has gone down from 11% to 9%, and I very much like to see that single-digit number, 9%. So again, mixed bag, more to do. Take some real comfort and some real inspiration from that last number, because that's a real good sign. But let's keep focused on the mission, and we will get there together. Okay, a few words in Spanish. Los neoyorquinos se han adaptado tan bien en esta crisis. En ningún lugar más que en nuestras escuelas públicas. Nuestros hijos necesitan desafío y enfoque. Y eso es justo lo que les vamos a dar este verano. Vamos a estar listos para que este próximo año escolar sea el mejor en la historia de nuestra ciudad. With that, we will turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
Just a quick reminder that we have Chancellor Carranza in the Blue Room, and on the phone we have Dr. Barbeau, Dr. Katz, and Commissioner Campion. Alex from Chalkbeat is up first. Alex?
Mr. Mayor, two quick questions. One, I'm assuming the expansion of summer school is meant to help students who have struggled with remote learning. So I'm just curious, like, how more remote learning will help? Like, will it be different at all from what students were getting during the regular school year? And two, you've talked a little bit about situations where it could be mandatory and situations where it wouldn't be. Can you just spell out a little bit more clearly, like, when this will be mandatory and when it won't, and whether parents can elect into it if they want to? Like, if they think their child might need more support over the summer, can they ask to be part of it?
Alex, I'll start and turn to the Chancellor. Look, the question's fair. If a kid hasn't done everything they need to, how does more help them? Well, first of all, I'd say a lot of kids, the disruption, the having to get used to a new model, there's a certain amount of drag, there's a certain amount of acclimation, and that's true for all of us. Educators getting in the swing of it, parents getting in the swing of it, kids getting in the swing of it. Also, a lot of kids, as we said, didn't have the technology, we had to get it to them. But I think it's really true to say with every passing week, everyone's learning how to do it better. So if a young person couldn't get done everything they needed to do, but we have, more time and a more flexible approach that we can apply in that time, it stands to reason that you're going to see additional gains. So that's something that I'm convinced is going to work for a lot of kids. With that, on the other questions you asked, turn to the Chancellor.
Yes, so thank you. Thank you, Alex. I think what's important to understand here is that the people who know their students best are parents, teachers, and principals. So the recommendations as to who is required to attend summer learning and who is recommended is going to be that individual analysis that teachers in communication with parents are having in terms of their child's academic progress. There are some students that will be required to attend summer learning. For example, students that at the end of the term are recommended for non-promotion, they'll be required to go to summer learning. Students at the high school level that have an in-progress classification will be required to go to summer learning. But there are others, and to your question, that communication, that back and forth between parents and teachers could lead to a student being recommended because they have more gaps to fill or they have more learning that they need to do. This is why the two words we've used from the beginning of our pivot to remote learning, flexibility and patience. And we're really going to count on our parents and our teachers to continue in that mode. But there's a myriad of reasons why a student would be required or recommended. And again, the people that are best positioned to make those kinds of decisions are their teachers, principals, and parents working in concert.
Emily from New York One is up next. Emily.
Mayor de Blasio, how are you, and how is everyone on the call? I wondered if the projection of students in grades 3 to 8, much higher than those who were managed to attend summer school last year, if that's an indication that some students have fallen very far behind during the pandemic, during remote learning.
Yeah, Emily, I think it's quite clear that you take away, months of the school year in the much more effective setting of everyone being together in a school building where teachers can use all of their skills to maximum impact. Of course it's going to have an impact, and it's going to be a negative impact in a lot of cases, but what is important is how much ground has been made up by kids, by parents, by educators in the meantime. And it's actually very striking to me. I think this is, very legitimate glass half full, how many kids manage to keep going and keep learning so effectively. But it stands to reason. It would be harder, and some kids would have to need more time and more help. But the fact is, here's the good side of the equation with distance learning. It's very flexible. You can do it, different times of day. You can do it weekends. You can do it summer. And so it's going to give us that catch-up opportunity. So unquestionably, more kids need the help than would have been true in a traditional year. But we also have tools to work with to get that done. You want to add?
I'll only add, Mr. Mayor, that we looked at last year's data in terms of how many students were being served in summer learning. It's not an apples to apples comparison because there was a lot of other kinds of summer programming, and schools had their own individual summer programs. This year is going to be centralized because we want to reach as many students as possible. Again, the academic term has not finished either. We haven't ended this school year, so we are projecting and providing capacity to be able to serve as many students as possible, and students that will need this kind of support. So it's a combination of both being prepared and also looking and triangulating the data from last year and looking at what should we be ready to do. We feel very confident that every student that needs this kind of support, and we want to make sure that teachers that recommend summer learning for their student, there will be a place for that student to be able to have that service.
Sean from the Daily News is up next. Sean.
Good morning, everyone. Another question about summer school for you, Mr. Mayor and Chancellor Carranza. Can you provide details of the pre-recorded lesson component and address possible concerns that kind of approach won't really engage students? Also, on line of duty benefits, given that both the state legislative process and basically everything in Congress can take a lot of time, why not use your emergency power, Mr. Mayor, to expedite some level of funding out of the city budget to families of first responders? Thank you.
Thank you, Sean. I'll start and pass to the Chancellor on the other question. We're going to do whatever it takes, Sean, to make sure these families get these line of duty benefits. I believe the legislature will act quickly. They're planning to act on some other matters, to the best of my understanding. I think this is something that, knowing the city supports, they would embrace and they would act on. So according to everything I understand about state law, the right way to get this done and the way that will really have both the immediate and the lasting impact for families is to do it through the state legislature. If we sense there's going to be a meaningful delay there and there's other things we can do, of course, I'll look for every way to help these families. But I think this is something that will get, real immediate attention from our colleagues at the state level. Chancellor, you want to speak to the other piece?
Sure. So the learning modality over the summer will be a mixture of live learning, virtual learning, and some pre-recorded learning as well. But our focus is to have as much live learning as possible. In the education speak, we call it synchronous learning. Now, the time period between the end of this academic semester and the start of summer learning will be used for additional professional development for our teachers that will be teaching in the remote learning venue over the summer. So we will do some more skill development. Actually, we have quite a number of teachers in New York City that are already very skilled at remote learning, synchronous learning, live teaching, if you will. So we're going to also tap into their expertise and share that broadly over the summer as well as how we prepare for any eventuality as well. So it'll be a mixture, but again, it's all focused on making sure that students are engaged and they're making up or taking care of whatever educational requirements they need. The one other thing that I can't emphasize enough is these one-on-one check-ins that will happen. Counselors will be available, social workers are going to be available, teachers will be checking on students. So again, the social-emotional needs, a trauma-informed pedagogy that we will be providing to students and families over the summer is in many ways just as important as the academic needs being addressed as well.
Aaron from Politico is up next. Aaron.
Morning, Mr. Mayor. Two questions. One about line of duty. Do you have an estimate for how much this will cost? And just to clarify, you're talking about all city workers, not just uniformed first responders, right? And my second question is, have you discussed with the governor what will happen if the city hits the state's indicators, but not the city's indicators? It sounds like you said the state indicators should be hit in the first half of June. We haven't seen long stretches of continuous progress on the city ones. So what's going to happen if those aren't in sync?
Aaron, on your first question, we'll get you the dollar estimate, but the bottom line, yes, all city employees who died because of COVID-19, so let's be clear, all city employees who died because of COVID-19, their families will receive death benefits. This is what the city of New York wants to see happen. This is what I want to see happen. Again, we'll go to the state legislature to get this done. We expect a lot of partnership there. The indicators, look, I believe that they are going to link up. I believe they're obviously interrelated. They're not two different universes. There are statistics and facts that interrelate to each other and move in very similar fashions. So it's clear to me, looking at both, that the first half of June is the time where they all come together. If we think for any reason that's not going to happen, we'll have that conversation with the state. But I think there's been tremendous unity with the state on the fact that we're going to be careful and smart about when to do the first steps of reopening. We're going to watch carefully in each phase to make sure things work and don't go in the wrong direction. We're all very devoted to avoiding that boomerang. So it's a very fair question, but I strongly believe they will align. And as we get toward that point, if we don't see enough alignment, we'll have that conversation. I'm sure we will be able to find a common strategy to go forward.
Yelov from the city is up next. Yelov.
Hi, everyone. I wanted to ask about the health department's analysis of what's happening at NYCHA as far as coronavirus. In a press release, it said yesterday, quote, "The findings show that the degree to which residents of NYCHA have been affected by COVID-19 is proportionate to their representation of the city's population." Now, my understanding is that that was based on the number of confirmed cases, not on the number of deaths, which did show a disproportionate impact. So my question is whether the death data was factored into that conclusion by the health department, and if not, why not? Separately, I just had a quick question about testing sites. The health department put out a very useful map yesterday on where the sites are located. Thank you for that. But it looks like on the map there isn't a site anywhere near the Rockaways, which is one of the hardest impacted areas of the city. So wondering where the closest site is and why there isn't a site that's closer there. Thank you.
Thank you very much, Yoav. Let me confirm, because now we're over 150 sites. The team here will get an answer either right now, hopefully, or to you right after. But we're trying to reach every neighborhood and keep building from there. So I want to confirm if there isn't a good site there, we'll get them one right away. But I want to make sure out of the 150, I want to see if your assessment is correct there. Look, any place that needs more, the goal is to keep spreading the testing farther and farther around the city, keep adding more and more sites. So this will be a constant growth effort from now on. On the question of NYCHA, look, we have been trying to really focus on people who live in public housing now for years, long before this horrible virus. And I have to be blunt that for a long time, I think the city government tried to ignore its obligations to public housing. And we, over the last years, have put a huge amount of resources into trying to improve the lives of public housing residents who have gone through so much. They happen to be folks who fall exactly into the categories of people who have borne the brunt of this crisis. Obviously, overwhelmingly lower income folks, people from communities of color, folks who in so many cases have not been given the health care they deserved over years, because health care is still given out according to your bank account, not your need in this country, and that's wrong. We're trying to fix that with guaranteed health care. What the data I saw said, I think you're right to say there's a difference between the people who have been infected by the disease versus the number of deaths. The number of people infected by the coronavirus in public housing appears to be almost exactly consistent with the amount of people in public housing and their presence in the population in New York City. The death number is higher. I think the fact is that we're always trying to understand what we need to do to serve people and help people. I know in NYCHA there's been tremendous devotion to making sure that residents got whatever help they needed. We've set up testing sites at NYCHA. The state has as well. We've distributed face coverings to NYCHA residents for free, food initiatives. NYCHA's been on a very rigorous cleaning schedule. So we know there's been a whole host of initiatives taken to protect people, and those will continue and will deepen. So that's the approach we're taking to protect our residents of public housing. Commissioner Barbeau, you want to add?
Mr. Mayor, we are and have been and will continue to be committed to transparency. And we've been clear that, yes, COVID-19 has affected communities of color disproportionately. In fact, Black and brown people are dying at twice the rate of white New Yorkers. And we're committed to ensuring that, that information informs this response. And as the mayor said, there have been testing sites put in NYCHA facilities. I want to just make it clear that in the press release that we put out, we also included the number of individuals who died because of COVID-19, either confirmed or probable, and were residents of NYCHA. And, we've lost, unfortunately, a little bit over 1,100 people who have lived in NYCHA. So you are very committed to ensuring that, we look at the data in any and all ways possible. And that's why we put it all out, because it's important for us to make sure that we are transparent in this, in that we give communities the opportunity to interrogate the data and ensure that we are not missing ways in which we can further help support all New Yorkers, and especially those living in NYCHA.
Next is Bridget from WNYC. Bridget?
Good morning, Mr. Mayor. Two questions. One, just to follow up on some of the summer school announcements. I'm wondering if you or the Chancellor could talk any more about the criteria that will be used to decide what students should attend summer school this year, given how different the learning experience has been. And then secondly, related to this new health department data that was released yesterday, another follow-up. For some of these areas that we saw such high death rates, specifically places like Starrett City and Far Rockaway, in addition to some of the demographics that helps explain why there's such a high prevalence there, is the city trying to understand if there's any other, physical infrastructure issues, like the airflow between apartments, that could be part of the cause for why the spread and the death rate are so high there?
Thank you, Bridget. Let me have the Chancellor go first, and then we'll turn to Dr. Barbeau and Dr. Katz for their thoughts.
Sure. So, Bridget, thank you for the follow-up. Again, the recommendations for summer school, including required attendance and recommended attendance, are all based on the teacher's analysis of the academic progress of the student. That's not done in isolation. It's done in consultation with parents. It's also done at looking at the entirety of the student's academic performance over the course of the year. It's important to keep in mind that when we pivoted to remote learning, almost 3/4 of the school year had already been logged. So there is all of that time as well to keep in mind as well. Earlier there was a question about, is there an opt-in option? There isn't an opt-in option, but if a parent does feel that their child needs some additional instruction in this summer remote learning venue, that's a conversation they should have with their teacher. The required elements for students to attend summer learning are obviously at the high school level, students that have been given in progress mark, or students that have not completed the requirements for one of the courses. And for other students, it's students that have been recommended for retention in June. Those are the lower grade students as well. Those are the two hard and fast rules. The rest is really based on that analysis that teachers and parents and principals will make together as they look at the academic progress of their children.
Thank you, Chancellor. Dr. Barbeau?
So with regards to the parts of the city where we're seeing higher transmission, we are continuing to look into and investigate cases and try and identify potential clusters. We have not identified any clusters that have been linked to transmission through, for example, apartment ventilation systems. There is, to my knowledge, no indication in the ever-growing literature that's being put out by scientists across the world in terms of COVID-19 being transmitted through ventilator systems. And so, it's something that we are continuing examining the literature, and I think the best advice that we will continue to give New Yorkers is what we've been saying with regards to the best way to slow down and stop transmission of COVID-19 is for individuals to practice good hand hygiene, practice good respiratory hygiene, meaning covering your mouth and your nose when you cough or you sneeze, diligent hand washing, use of face coverings when you go outside, and staying indoors as much as possible.
Next is Matt from Newsday. Matt? Hey, Matt?
Matt,
Good morning. Can you hear me?
There you go. How you doing?
Hey, good. I'm doing all right. How about yourself?
Good, thank you.
For the mayor, will a business hosting an illegal gathering be spared a summons provided the gathering disperses immediately upon request? And for Dr. Barbeau, was the PPE in that depot at issue in March primarily intended for healthcare workers,
Wait, say that again, please, that last part.
Sure. For Dr. Barbeau, the PPE at issue at the depot in March, was it primarily intended for folks who are healthcare workers?
So, Matt, let me start on that, and we'll turn to Dr. Barbeau, and then I'll answer your other question on the businesses. Again, I think the frame of the question misses the way we had to approach this from the beginning. And I was intimately involved in the efforts to find PPEs all over the globe to protect our people. I spent a whole lot of time, whether it was on the phone with the White House or FEMA, or whether it was calling people who had leads to get us PPEs, or talking to CEOs of companies who produce them, or working to get them produced here in New York City. So I can tell you from a lot of knowledge that from the beginning, it was clear we were really in a dangerous situation of not having enough of a supply coming from the federal government or from the international market. And we had to keep building that supply rapidly. But we had to think about that supply in terms of the needs of our hospitals, our healthcare workers, and our first responders, because everyone was interconnected. An EMT or a paramedic who brought someone to a hospital was in the same connection that doctors and nurses were who treated that patient. Many, many times, our police officers had to go into situations where they were dealing with people with COVID-19 and had to help them in a variety of ways. And everyone deserved protection. So again, I have a feeling of tremendous respect for all of our public servants who serve at the front line. Our first responders, we were asking so much of them, they deserve protection. Our healthcare heroes deserve protection. Our job was to take whatever we had, get it to everyone who needed it, and then keep finding more all the time. And there was not a choice of saying, oh, you know, you're a correction officer or police officer or firefighter, EMT. We don't think we can give you something because we have to give it to someone else. No, we looked from the position of we had to supply the correction officer, the EMT, the paramedic, the police officer, and we had to supply the doctor and the nurse and the healthcare worker. So that was the understanding from the very beginning, and to constantly try and make sure that we got what we needed, where we needed in time. But against a tough, tough backdrop where it was constantly a challenge. And if we had just worked with the supply we had, we would have been lost in a matter of weeks. We had to constantly focus on expanding supply, and that very successful effort, and a lot of credit goes to a core group of people. Emma Wolf played a key role, and Jackie Bray, and Jimmy O'Neill, and Dan Simon, and many, many others. They succeeded every week in finding more and more and more, which is why we were able to keep those who needed PPEs in a steady supply of them at the crisis level. I want to emphasize, Matt, not the level we would have ideally wanted in terms of the PPEs, but at the crisis level according to the CDC standards. So I want to give you that framing. Let me go to Dr. Barbeau, and then I'll come back on your second question, Matt.
Thank you, Mr. Mayor. And yes, I think the way that you put it is exactly how I was going to put it. These were crisis situations where, of course, we needed to provide personal protective equipment for all of our first line responders and doctors, nurses, NYPD, EMTs. And we were making hard decisions all the time. And I want to just make sure that there's no ambiguity, that we value all of our first responders equally, and that we were all working under extremely tough situations, but that we were working as a team, and we were able to provide personal protective equipment for our first responders. Do we wish we were able to do more at that time? Absolutely. But, we were working under such extreme circumstances and really looking to every day secure additional resources for the heroes on the front line. So, Mr. Mayor, I echo your framing, and I just want to clarify that there was always a spirit of collaboration, and I wish every day making hard decisions, that we were able to do more at the time. But the great thing now is that we're able to provide the ongoing PPE that our first responders, NYPD nurses and doctors, EMTs need every day.
Thank you, Doctor. Want to take one step back before answering the second part of Matt's question. Yoav asked the question about the Rockaways. Based on what's been handed to me, Yoav, I think you're right. And the update is there will be a site in the Rockaways opened on June 1st. So that's going to be corrected quickly. And as I said, there's going to be many additional sites around the city. On Matt's question, Matt, you'll remember the day that I directed that restaurants and bars no longer serve people in person, no more dining in restaurants and bars, drinking in bars. That was a long time ago that we made very, very clear that was unacceptable. And you'll remember in the days after, we sent out a massive enforcement operation, and actually very few restaurants or bars were not complying, and most, if there was any outstanding issue, corrected it immediately. And we only found a few instances where there was resistance or unwillingness to address what needed to be addressed. And these are for-profit businesses. And where we found that, there were some summonses, but it was a handful. Since then, we have not found there to be a problem. We've had a few reports lately, but again, our goal is wherever possible, if we see a problem, we just want the problem corrected. We're not trying to take money out of people's pocket in the middle of an economic crisis. We want the problem corrected. If there's resistance to correcting the problem, then we will unquestionably issue summonses. If there's continued resistance, more summonses, or even close down a business or a building. So I think, as much as I understand the real desire to see clear, linear dynamics, the one thing I want to emphasize is the overwhelming reality has been people have done what we've asked them to do, and most people, when reminded, take the reminder and act on it accordingly. And we have very, very rarely, since this crisis began, had to use summons. But when we need to, we will. It's quite clear. If the only way to fix a problem is with a summons, we will absolutely use a summons.
Jeff from the New York Times is up next. Jeff.
Good morning to the mayor and the panel. Two questions. The first one is for Dr. Barbeau. Dr. Barbeau, after attending 54 out of 55 news conferences since the first positive case of coronavirus in New York City, why have you been absent from the last 4 news conferences? The second question is for the mayor. Mr. Mayor, who among your commissioners and senior staff is in charge of the city's public health response to the coronavirus pandemic?
So Jeff, I'll start. I see you're always interested in personnel matters, and that's great, but I think you should never miss the forest for the trees. This is a team effort. It was constructed as a team effort. It has been a team effort. It will be a team effort. And whatever definitions you or anyone else wants to put on, that's fine, but we're the government here to serve people, and we build the operation that will protect New Yorkers, and that's exactly what we've been doing. So the way I look at it, we have a team, Dr. Perea Hense as deputy mayor, working with commissioners under his leadership, including Dr. Barbeau and Dr. Katz, Jay Varma's good work as my senior advisor, and we work with the state and we work with the federal government. And this is something that we work on literally, of course, every single day. So that's the way we have structured things. The major decisions come right here to me. Throughout this whole crisis, that's been the reality. This is the farthest thing from business as usual. And the other reality is that when we organize a press conference, and we've been having them incessantly, we put together whatever group of officials makes sense for that given day. And that's what we'll keep doing. So you can expect that every day you'll see different lineups, and that's been the reality from the beginning, and you should expect that going forward. But again, I don't know. I think some people like to see things in silos. I don't. I've spent 6.5 years breaking down silos in this government and trying to create much more of a team approach. And that's the only way to handle something of this magnitude. So that's how we've structured things. Dr. Barbeau, you want to add?
Mr. Mayor, just to echo what you said, that this response has been characterized by a team, and I am committed to continuing to work as part of that team.
Thank you.
Last two, Kathleen from Patch. Kathleen.
Hi, this is a question about the summer programming. How and when will families find out when their kids have taken these classes? Will they be staggered through the summer, or will they be taking place in one block of time, say July and then 2 weeks in August? And then my second question is, do any of the summer programming include opportunities for kids to be earning some money this summer, as they might have done before the crisis hit?
So, Chancellor, you're going to talk about how you're structuring the programs. Look, Kathleen, on your question, we very much want to think about anything and everything we can do to help our young people this summer. The traditional methodologies that were available to give kids summer opportunities where they could earn money, those have obviously been profoundly disrupted. Our budget's been profoundly disrupted. But we're going to still keep trying to find solutions. We're going to work with the City Council to see if we can think of creative ways to move forward. But in the meantime, we're going to make sure, even if kids can't get outside, that there's a lot of great opportunities for them to learn and have positive engagement during the summer months. Chancellor, you want to speak to the specific questions?
Sure. So the summer learning time will be in a block of weeks, 6 weeks. There won't be any staggering. It'll all happen simultaneously, July through August.
Last question goes to Duncan from the Gay City News. Duncan.
Hi, Mayor. I hope you're doing well through all of this.
Thank you, Duncan. How have you been?
I've been fine, thank you. I have a very quick question about shutting businesses down, which you've spoken to. Exactly how do you propose to do that? Do you have to go to court to get a temporary restraining order as a prelude to a court case? Can the health department just shut it down? Can the NYPD just shut it down? What's going to be the methodology if you have to do that?
It's a great question, Duncan, and I'm happy to say, and our team will get you the exact scorecard here, if you will, but I gotta say, whatever we may have thought would happen in a situation like this, our city has been amazing in the sense of how little we have seen. Again, it's now been, March, April, halfway through May, 8.6 million people, and the greatest healthcare crisis we've ever seen. You might have expected a lot of people to not make the adjustments or try to resist or be really greedy, and you didn't see that. You saw the vast, vast majority of people really respect what had to be done in this crisis, support each other, do the right thing. Again, that right after the order on the restaurants and bars, I would not have been shocked if there was a need for a certain amount of enforcement. There was almost none necessary in terms of any kind of sanction. So I do think it's important to recognize how rare it has been that we have needed to take the more rigorous measures. Now, you talked about the process, and again, we will get you more information about the specifics. The court system's obviously not functioning as normal right now. Best of my understanding, immediate actions by the police department, fire department, buildings department, sheriff's department. If they see something that is an immediate danger, they can act. Obviously, we're under state of emergency, so that empowers actions on behalf of public health and safety. But I also understand the health department's ability to issue a cease and desist order if they see something that presents a public health hazard, and the commissioner's order is something that could be acted on very quickly. So Commissioner Barbeau, you want to add to that? Well, let's try again. Commissioner, you hear me?
Sorry, Mr. Mayor, I had some technical difficulties.
No worries.
I think you've covered it. I covered it, and I don't know that I would have anything else to add beyond what you've already laid out. Thank you, sir.
Thank you. Okay, well, everybody, I again, as you can hear in each day's presentation, I'm very sober about the challenge we face, but I'm also very hopeful. And I'm hopeful because I believe in the people of this city. I've been watching in a way that no one else gets to have the vantage point your mayor gets to have. And I've watched every corner of the city and how people have reacted to this crisis. And it's been outstanding. And it gives me a lot of hope for the city and its future. Because people do this much good under this much duress. That's a special people. That's who New Yorkers are. But I have a special feeling for our young people. And I want to focus on them in these last few words. Because I've seen so much in our young people. They're going through a lot, as we talked about earlier, but I've seen so much strength in them. I am probably affected by the fact that I'm the parent of a 25-year-old and a 22-year-old, and they're proud graduates of New York City public schools, and every moment of their education occurred in our public schools. But I saw in them, and I saw in so many of their contemporaries, and I've seen in a lot of young people I've met since, a strength, a kind of steeliness that I think was evident long before this pandemic. I think it's been the reality of a generation that grew up with a lot of challenges. Sometimes they remind me of some of the stories I used to hear from my older relatives who grew up with the Depression and World War II. These kids of today, maybe it wasn't quite that, but they did grow up with the Great Recession. They did grow up with the threat of global warming looming over them. They've grown up and learned more earlier in life than any generation in previous human history because they've had access to so much information, and information that caused a lot of them to grow up real fast, maybe sometimes too fast, but that's been the reality. So this generation, a generation I think in their own way is pretty tough, has then had to confront the coronavirus. And it's asking a lot of our kids, but what we've seen already is how many of them have found a way and have found a way to keep learning, and have found a way to, somehow make sense of a situation which is so confusing to all of us. This is the generation that will one day inherit this city. And I see a lot of strength in them. And it's our job to support them. It's our job to foster their futures, to believe in them, to do things that will support them, even if they're things we haven't known how to do before, like distance learning. We're figuring it out. They're figuring it out, and we better figure it out too to be there for them. But I will tell you, when we come back in September, as I said, we're going to have the greatest school year we've ever had because we have to. We owe it to them. And they will be a new version of a greatest generation, and they give me a lot of hope in terms of what kind of city we can have in the future, because they will be ready, and it's our job to help them be ready. Thank you, everybody.